Hello, class, and welcome to today's lecture on affective disorders. Now, affective disorders are a group of mental health disorders that are characterized by disturbances in mood or affect. And they can significantly impact a person's emotional state and interfere with their ability to function in daily life. These disorders are also known as mood disorders and are among the most common types of disorders. The symptoms of affective disorders can vary from the specific disorder, and they can include things like feelings of sadness, or feelings of worthlessness, or hopelessness, or guilt, or irrationality, or fear, or anxiety. So, not very pleasant. In some cases, these feelings can be so severe that they interfere with a person's ability to carry out their daily tasks and to adjust to the challenges of the day. And in some cases, the symptoms may be less severe but can still cause significant distress for an individual, even though they can outwardly appear to function quite normally. Now, in this lecture, we will explore a few of the different types of affective disorders. We will include the broad strokes picture of depression, as well as a few specific anxiety disorders. And we'll discuss their prevalence, their symptoms, their causes, and maybe some treatment options, although we will save a lot of the treatment focus for another lecture. But I do hope that you enjoy this class as we dive into some of the most common disorders, affective disorders. So in today's class, of course, I want to start off by telling a story. And then we'll dive into some specific anxiety disorders. First, we'll look at the broad range of anxiety, and then we'll look at generalized anxiety disorder, as well as what are phobias and panic disorders. And we will close out this lecture then with a broad strokes picture of depression. Now, anxiety itself is the nervousness or agitation that we sometimes experience. And often, this is about something that is going to happen. It's a very natural thing that is part of life, and it helps us to prepare for what is coming next. We all feel anxious at times, and if we don't feel anxious, then that too can be signs of a disorder. Because anxiety in itself is very adaptive. It helps us. But sometimes it can be overwhelming and cause us to freeze or cause us to be less adaptive. Now, anxiety is normal. Maybe we think about our upcoming visit to the dentist or the presentation we're about to give in class this next week. And anxiety is an important and useful human emotion. It is associated with the activation of the sympathetic nervous system and the physiological and behavioral responses that help protect us from danger. But too much anxiety can be debilitating. And every year, millions of people suffer from anxiety disorders. And so they can be psychological disturbances marked by irrational fears, often of everyday objects and situations. Now, to protect patient confidentiality, I'm just going to give you some hypothetical clinical cases about anxiety. So let's think in terms of Sarah. Sarah is someone in her late 20s, and she's experiencing symptoms of anxiety, and she has been for years. She feels a sense of nervousness and restlessness and seems to constantly be on edge. Now, Sarah often worries about many things such as her work, her relationships, and her health, and she feels like she cannot control her worries, and they are really starting to interfere with her ability to focus on tasks or enjoy life. It's become overwhelming. Sarah also has certain panic attacks at times, which she describes as almost like a overwhelming heart attack. But she doesn't have any physical problems. She describes this feeling of having this sudden, intense feelings of fear and discomfort that come out of nowhere. And she reports physical symptoms during these attacks, like her heart is racing, she's sweating, and shortness of breath. And hence, she feels like she's having a heart attack, but she's not. Sarah says that she's tried to avoid situations that she thinks might trigger these panic attacks, but it doesn't seem to help. But she does certainly restrict her behavior. In fact, it's become very rigid. She avoids almost all social situations now. She avoids driving on the highway, and she needs to drive on the highway to get to work. She avoids being in enclosed spaces. Now, Sarah's symptoms have started to really impact even her daily functioning. She has difficulty sleeping, and she's lost weight because she doesn't feel like eating. And she's also struggling at home and has been absent several times at work due to her anxiety symptoms. And Sarah has been to her physician several times. At first she thought she had heart problems, but she has since been referred to a mental health professional for further evaluation and has now been diagnosed with generalized anxiety disorder and with panic disorder. And that's something to kind of keep in mind, is a person doesn't necessarily just have to experience one disorder. Sometimes various disorders can occur simultaneously. It's called comorbidity. Now, the mental health professional and Sarah have worked together to develop a treatment plan that includes both medication and therapy, because these anxiety disorders can significantly be helped by certain medications. In this case, antidepressant medication, which calm down her arousal system. In addition, she has been referred for cognitive behavioral therapy to help her adjust her negative thinking patterns, because that also plays into her anxiety and her panic attacks. Now, over time, with treatment and with support, Sarah's symptoms have begun to improve. It wasn't a fast, instant thing. The medication didn't kick in, really, and she didn't see any effects for several months. And the same with the cognitive behavioral therapy. But she has now returned to work and now feels more in control of her anxiety symptoms. She does still experience anxiety from time to time, but now it's adaptive. And so she's no longer paralyzed in her daily life and in her work. So that's all a positive. So that's a little story of something that can happen, some experiences that a person can have within this range of affective disorders. It may not appear dramatic to the people outside of the individual's life, but to the subjective experience of the person themselves, it can be overwhelming. And that's something we need to kind of keep in mind. So let's take a look at some anxiety disorders. There are many different types of anxiety disorders, but some of the most common are generalized anxiety disorder, panic disorder, and phobias. And so we'll look at each of these in a very cursory manner, but hopefully it'll help you to get some sense of what is going on here. Now, generalized anxiety disorder is a type of anxiety disorder characterized by excessive and uncontrolled worry about everyday things. And it's estimated that approximately 7 million people in the United States are affected by generalized anxiety in a given year, making it a relatively common disorder. Now, symptoms of generalized anxiety disorder, sometimes called GAD, G-A-D, include excessive worry, restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. And these symptoms can be persistent and last for months or even years, leading to some significant impairment in daily functioning. Now, diagnosis of GAD involves a comprehensive evaluation by a mental health professional, as in the case of Sarah that I talked about in that story. It sometimes can involve a physical exam to review an individual's medical history and to rule out other possible physical causes. And, of course, it's going to include discussing how symptoms are impacting a person's life. And if you recall the DSM-5, which is kind of our more current diagnostic system now, when a person has met the criteria for GAD, such as persistent and excessive worry about a number of different things, difficulty controlling the worry, and the presence of physical symptoms such as muscle tension, restlessness, and fatigue, then the diagnosis is appropriate. Now, it's often over a period of time. Now, one of the treatments, just like with Sarah, for GAD involves medication and therapy. Now, antidepressants, something known as a selective serotonin reuptake inhibitor, SSRIs, as well as serotonin norepinephrine reuptake inhibitors, SNRIs, are often prescribed to help manage symptoms. Now, just a little bit of an aside there. Basically, what these medications do is help stop our bodies from breaking down serotonin and something known as norepinephrine, which are two types of neurotransmitters. And what these neurotransmitters do when the levels start to increase within the brain is they tell the parts of the brain that are automatically looking for danger to calm down and just relax a little bit. And that hypervigilance then begins to dissipate within the brain, and over a period of months, then a person's thinking, the impact upon the unconscious self starts to turn thinking patterns into something a little more positive, which then eventually ends up creating a sense of better well-being. And so there isn't this overwhelming sense of anxiety anymore. So it's a cycle of things that takes time. And you just need to be mindful that patience is required in dealing with affective disorders. Now let's look at a clinical case of an individual with generalized anxiety disorder. So we'll think about John. John is a late 30-year-old male who's experiencing symptoms of anxiety, and he has been for many months. John reports feelings of anxiety and worry most of the time. Now, when there is no significant reason to be concerned about something, objectively he knows, or other people have reminded him that these are not things to be worrying about, and yet he worries constantly. And he feels like he has a difficult time relaxing, and he always feels on edge. And he also experiences physical symptoms such as muscle tension, stomach aches, headaches, that sort of thing. And when he visits his physician, it doesn't seem to help. His physician refers him to someone specializing in mental health, and he is diagnosed with generalized anxiety disorder. And so Joan's treatment is that combination of antidepressants, which take time, and therapy. And in this case, CBT is a very good treatment for affective disorders, and because it helps to challenge those negative thought patterns and to manage the anxiety symptoms. And so over time, again, this never happens within the first month and rarely in the second month, but in the third and fourth and fifth months, the treatment becomes successful. John's symptoms improved and he was able to resume his daily life and his activities without this excessive worry and anxiety. So, there's some positivity that can happen. Then, let's look at panic disorders. Panic disorders is a type of anxiety disorder characterized by sudden and unexpected panic attacks, which are these periods of overwhelming, intense fear and discomfort that peak within a few minutes. And it's estimated that around 2 to 3% of the population are affected by panic disorder each year. And again, it's kind of like you're having a heart attack, but you're not. And the symptoms of panic disorder are things like intense fear and palpitations and sweating and trembling and shortness of breath and chest pain and nausea and dizziness and feeling like you're losing control or you're going crazy. And basically what's happening is part of your brain that tries to protect you from extreme danger just takes over. And what is normally very adaptive becomes very dysfunctional because it doesn't meet the situation. So panic attacks can occur unexpectedly without any obvious trigger and can be triggered by specific situations such as being in a crowded space or having to speak in public, but it doesn't have to be. In fact, the part of the brain that controls this even evaluates the quality of the air, and so a little bit of disruption in the quality of the air can actually trigger this in some cases. Now, diagnosis of panic disorder involves a comprehensive evaluation by a mental health professional, and of course you want to, in cases like this, be evaluated by a general practitioner physician as well, just to rule out any possible health conditions. For example, mitral valve prolapse, which is a heart dysfunction, can mimic panic disorder. So you need to want to clarify, is it a purely physical thing or is it a psychological thing? And the DSM-5 has specific criteria about panic disorder that include things like the presence of recurrent unexpected panic attacks and the persistent concern about future panic attacks. And so sometimes panic disorder is considered fear of fear. You start to worry about having the panic attack, which kind of starts a nasty cycle. And some of the treatments for panic disorder, again, selective serotonin reuptake inhibitors, antidepressants, as well as cognitive behavioral therapy are effective in these cases because it helps you to disrupt those negative patterns, that fear of fear that can start to develop within it. And so when you start to practice positive thinking, you can actually change your neurochemistry, you can change the conductivity between different parts of your brain, and that can help to prevent it. Now, another kind of medication that sometimes is used is benzodiazepines, which really calm down everything. And so there's some risk there with benzodiazepines. But in cases where the panic disorder is so extreme and so intense, they can be helpful. Now, a little bit of a clinical case. Let's look again at Sarah, that lady in her late 20s. When she experienced these sudden and intense fears over a period of months, she felt palpitations and sweating and shortness of breath and trembling in her body. And it wasn't just a one-time thing. She ended up in emergency rooms several times because she thought she had a serious physical condition. But after evaluation, it was recognized that it was panic disorder. It took some time, but she was given medications and given the kinds of psychotherapy that helped her with the patterns of thinking. She was also guided through learning how to calm herself through deep breathing and through progressive muscle relaxation. So she began to have good routines to help calm her body, and over time, being patient, she was able to cope with the physical symptoms of panic attacks. And over time, and with treatment and with support, Sarah's panic symptoms began to improve, and she began to be able to resume her daily life without the fear of having more panic attacks. The fear of fear began to subside, and she was able to become more adaptive again. Now, let's take a look at phobias. Now, a phobia is an excessive or unreasonable fear of a specific situation or a specific object or a specific activity that leads to avoidance or extreme anxiety when exposed to it. Now, phobias can interfere with an individual's daily life and lead to significant distress and impairment. Phobias are really the most common type of anxiety disorder, and it's expected that about 9 to 10%, so 1 in 10 people, experience some kind of phobia. Now, there are 3 main categories of phobias. There's specific phobias, there's social anxiety disorder, and there's agoraphobia, which kind of all tie together. Now, so we'll kind of throw them all in together in this case. So let's discuss some of these specific phobias first off. Now, a specific phobia is an intense and irrational fear of a particular object or situation. So think in terms of, I'm afraid of heights, or I'm afraid of talking on the phone, or I'm afraid of spiders, or I'm afraid of flying in an airplane. Now, people with specific phobias often go to great lengths to avoid that object or that situation that triggers their fear. For example, someone who has a fear of flying may avoid air travel altogether, which can limit their personal and professional opportunities. Or you are afraid of spiders, and so you decide that you're going to live in the Arctic where there aren't any spiders. Those kinds of cases give you a sense of what a phobia is. Now, a clinical case that really kind of illustrates a specific phobia, let's take a look at Jane. Jane has a phobia of dogs. And even the sight of a dog on TV can cause her extreme anxiety and panic. Now, Jane goes out of her way to avoid any situation where she might encounter a dog, such as parks or streets where people frequently walk with their dogs. Her fear has caused her to miss out on social events and has made it difficult for her to enjoy time outdoors. Now, moving on to social anxiety disorder. Now, this type of phobia is characterized by a persistent fear of social situations and interactions, including public speaking or just dating or even just simple meeting new people. People with social anxiety disorder may worry excessively about being judged or embarrassed in social situations, which can lead to avoidance of these kind of situations. Now, an example of this might be Mark. Mark is a college student who's terrified of public speaking, and he experiences such severe anxiety leading up to a presentation that he might avoid the opportunity to speak in front of people and drop the class. And his fear has caused him to avoid taking certain classes that he is required to give presentations in, and this has significantly disrupted his whole education plan and even his career choices and opportunities. All because of a fear. Now, finally, there's agoraphobia, which is a fear that literally means fear of the marketplace. Agora is a Greek term for the marketplace. So it's a fear of being in situations or places where it might be difficult to escape from, or where you might be embarrassed, where you're out in the public, where you might not be able to, in the case of a panic attack or an emergency, to escape from, and people might look at you. So common examples of situations that may trigger agoraphobia are being in crowds, or public transportation, or wide spaces, or simply literally going to the store. Now, a clinical case that illustrates this is Michael. Michael is a young man who has a fear of leaving his house and going out into public spaces. He worries that he will have a panic attack and not be able to get help, and so he has limited his outings to just a few places where he feels safe. He will go to a small grocery store in the corner that costs 3 times as much as a regular store, but he goes there because it is the one place where he does not feel that he's afraid. Now, his fear has caused him to miss out on many social events, and he has great difficulty even maintaining relationships with his own family because of the fear. Now, in essence, anxiety disorders can really have a significant impact on an individual's life, and whether it is generalized anxiety disorder or a panic disorder or a phobia, there are significant disruptions. But there are also well-researched, evidence-based treatments for these, and so people do not need to be suffering from these disorders. And we need to kind of recognize that there are specific things that can help these people. And so if you are working in this field of social and community service worker, you will have the knowledge to know that people that are exhibiting these kind of challenges can have help, and you can provide them with the referrals required to get that kind of help, which I think is fantastic. So we're going to pause there and take a break, and we will come back and continue on looking at different types of disorders. In this case, we will look at depression. You take care. I'll see you in a little while.